Hey everybody, this is Dr. Vince from movementthinker.org. I'm a physical therapist and I practice out of Joliet, Illinois. On the first video, we covered introduction, passion, kinda. What do you do for a living? Outside of work, what types of activities do you do? And, what are your symptoms? Do you have pain and where are your symptoms? And this is where we're gonna start off with. So when I see you in the clinic, tell me about your symptoms. Where do you have symptoms? And I don't like to just say pain because some people have numbness, tingling, pins and needles. They call it pressure. I don't want to put the words into their mouth. So just tell me your symptoms and describe them for me. This is our opportunity to just have a conversation. Some people only have symptoms in their back. Some people only have symptoms in their butt. Some people have symptoms in their back, butt, and down their leg. Some people have numbness going all the way to their toes. Some people only experience weakness. Some people experience buckling. Some people experience sharp shooting, right? And so just tell me what you're experiencing. We'll work through this together. Tell me your symptoms. From there, how long have you had your symptoms? If your symptoms have been for a short period of time, okay, that gives me an idea as to what I'm looking for on the first day. If your symptoms have been there a longer period of time, well, then I got to rule out some things and try to work my way towards other things because there's a classification system that we use, and we're already starting to classify your symptoms once you start telling us where your symptoms are at and how long they've been there for. And so now that you've told me where your symptoms are at and how long they've been there, and let's talk about this for a short period of time. And again, I'm going to try to keep these videos at 7 minutes or less. If you tell me you only have back pain, we have absolutely no clue what's going on with you. Don't you have confidence, right? And I'm serious when I give that stat, right? So for the most part, unless you have cancer, unless you have a fracture, unless you have an infection, we are wrong 90% of the time if we try to tell you that it's this causing your symptoms because we don't know, right? Back pain in and of itself is very hard to classify the structure that may be causing the symptom because there's so many things that could go into it that could cause a symptom, and it may not be structural at all, right? There's a classification called affective, which means that your stress levels may actually be playing a role in your pain. And so we can't just make the jump that it's structural. So for those of you out there who believe it's your herniated disc that's causing your symptoms, I say maybe. Maybe not. Now, how long have you had your symptoms for? If you've had your symptoms for a week, well then you might not have developed scar tissue yet and created any sort of scar tissue based problems because it's been such a short period of time. Are your symptoms inflammatory if they've only been there for a week? Are they chemical in nature? When I say inflammatory, I mean chemical. And quite honestly, if your symptoms are chemical in nature, coming to physical therapy, I don't have chemical solutions typically. I have physical solutions, right? I have movement solutions, but I don't have chemical solutions. And this is where we would have a conversation with your physician or your nurse practitioner, your PA, whoever's referring you, that your symptoms appear inflammatory in nature and you may benefit from some version of an anti-inflammatory. They say you could use ice. Sure, not a huge fan, but you could. But you're going to need some sort of anti-inflammatory in order to calm down that pain. Getting back to it, some patients have symptoms that go down the leg, and it's not just back pain. Well, it becomes a little bit easier for us to classify that symptom that goes down the leg, and for the most part, symptoms that go down the leg, they're actually a little bit easier for us to work with than symptoms that are in the back only. Because symptoms that go down the leg, it tells us, you may have some nerve involvement, you may have nerve irritation, you may have, muscular involvement. There's a lot of possibilities there, but they're easier for us to narrow down if we can start moving the symptoms in and out of the leg, right? There's a higher correlation with the disc issue for certain symptoms that present a way when we either move them down the leg with movement or back up the leg with movement. We're a higher likelihood of being able to say that the disc may be playing a role. But outside of that, if we can't move the symptoms, it's hard for us to say where it's coming from, back to 90% being wrong, 10% being right. And that's okay, for those of us that are trying to say something just to give you an answer for the sake of being an answer is not cool. If we don't know the answer, we need to be able to say we don't know because nobody knows, right? And we have to feel comfortable saying that as a therapist. And if your therapist is trying to shove it down your throat that you have a disc problem, you have a facet problem, you have a piriformis problem, you have a SI problem, we're probably wrong, right? I try to avoid using that that bad anatomy term, pathoanatomy, disc herniations, and what have you. If I don't have to, if the patient's not bringing it up, I'm going to avoid using those terms because, again, once we start using those terms, we're guessing for the most part. It might be an educated guess, it might not be, but we're still guessing. So, yeah, again, symptoms down the leg are a little bit easier to treat than symptoms that are just in the back. And symptoms that are acute, that are short duration, they're a little bit easier for us to figure out than symptoms that have been here for a long time. And, one of the funny things is that if your symptoms have only been there for a week, we know that the natural course of back pain for most people is good. So, I've actually heard some clinicians say, if the patient has back pain, let's get them in today, because they might be better tomorrow if we don't get them in today. And if they're better tomorrow, we want them to think that they're better because of us, not because of time, right? And it's kind of shady, but, welcome to healthcare. That's just how it works sometimes. So the natural course of back pain for most people is you're fine, right? You're going to get better over the course of 4 to 6 weeks. If your symptoms have just started, I highly recommend you look up something called the Start Back tool. Fill out that little questionnaire, look up what it means, give it to your doctor, what have you, give it to your physical therapist. And your physical therapist should also feel comfortable saying, hey, you know what? You don't need me right now. Let's give this, 2 to 3 weeks on its own, and let's just see if it starts getting better on its own. And if it doesn't, then come back in. I'll see you in a few weeks. I'm not going anywhere. That's what I tell my patients. I live at this place. When I work in the clinic, I live here. You can always come back to see me in a few weeks. You might not need me by then. So, hey, thanks for listening to video number 2. So far, we've covered where you work, what you do. Are you active? Are you not? Where are your symptoms? And how long have they been there? Stay tuned for video 3.